Chapter 17, Drug Use, Forensic Toxicology, Workplace Testing, Sports Medicine, and Related Areas. This chapter I'm going to do a Cliff Notes version. Some of this we have exposure to as a phlebotomist and some we do not. So, overview and prevalence of drug use. Abuse is improper use. Addiction is relapse, compulsive use of, and dependence on or substance in spite of harmful consequences. Please see box 17/1 in your textbook, which goes into these terms more specifically. So, illicit drugs, illegal drugs, unauthorized use, so possession of marijuana, cocaine, heroin, non-medical use over the counter, or prescription pain relievers. Again, 17/1 in your textbook. The other thing to take into consideration too is if you're prescribed a medicine and you give it to someone that the prescription wasn't meant for. Healthcare workers involved with drug testing in the following situations. So they do it a lot for pre-employment assessment, acquire a new insurance policy, random workplace drug testing, court-ordered drug testing. The pre-employment assessment, it is a zero tolerance in the medical field. We need to be free of all of these. There is stipulations to if you're prescribed a medication by a physician. Healthcare workers involved with drug testing in the following situations. So drug monitoring for known or suspected abuse patients, pregnancy organ transplant, monitoring prescribed pain medications, and testing for drug intoxication overdose. When the monitoring prescribed pain medications lets us know how the body is also metabolizing the drug as well. It's also for legal investigations and detecting specimen adulteration, so tampering with a sample. Substance abuse and addiction impact. This is loss of work, productivity, cost of crime related, incidents and legal fees, and general health care, public health, social, psychological, and patient safety issues. So there's different types of testing options. There's smaller collection devices, better screening techniques, clinical laboratory automation, molecular advances in computer technology, which we will cover later in this chapter. Responsibilities for the specimen collector. We need to identify both the donor and the specimen, prevent specimen alteration or substitution, tamper-proof collection specimen, initiate and be accountable for chain of custody, and accurate and comprehensive documentation must be maintained. So initial screening test, rapid straightforward analysis that can detect multiple substances at one time. And then there's confirmation test. If the screening test were to be positive, more laboratory intensive analysis on the sample is required to get an exact amount or level. So this is why it's really crucial when we draw blood or get a urine sample that we get a specific amount in order for us to be able to do that confirmatory testing if we need to. Drug metabolites, so produced after drug processed in the blood, tissue, urine, or oral fluids, usually present in the body longer than parent drug. And the testing is more complex because of the variety of drugs and legal need to establish impairment or intoxication. Window of detection, so this is the period of time after using the drug that is still detectable. This can vary with each drug and specimen type. Specimen type being urine, blood, hair, saliva, and it depends upon the drug and the quantity taken. Drug analysis, the amount and type of drug, frequency of use, method of use, is it inhaled, ingested, injected, absorbed through the skin, how quickly is the drug metabolized in the body, and the cutoff concentration of testing procedure. The user's physical condition, body fat, and weight take a lot into consideration. Other pathological conditions such as kidney disease, because the body basically works through the waste and dispose of it. So a patient with a kidney disease may not be able to get rid of the drug as readily. Stability of specimen due to pre-analytical factors. The other thing too is a lot of the drugs sometimes get stored in a patient's body fat. So they may have more in their system or present for a longer period of time. So depressants, these are common types of drugs tested. Opiates, alcohol, barbiturates, stimulants, cocaine, for example, hallucinogens, LSD, and then cannabinoids. Specimens include blood alcohol analysis, usually done separately. Specimens could be urine, saliva, or oral fluids, venous blood, or hair. Hair is going to be the most expensive test to do, and it goes back possibly 10 years. There's also breath, nails, meconium, and sweat. Meconium is generally used when we're testing infants for potential drug exposure after delivery. Drug tests do not measure frequency of use, degree of impairment, presence of medical disorders, and it cannot usually distinguish between prescription, over-the-counter, or illicit street drugs. This is why sometimes it's really important that you either tell the testing technician or have the prescriptions on hand, so if you are called about it, you have proof that it was prescribed to you. Drug testing methods, there's point of care testing, there's gastrochromatography, mass spectrometry, high performance liquid chromatography are some of the ways drug testing is used. We primarily as phlebotomists will focus on point of care. So drug testing in neonate or pregnant mothers to determine prenatal drug or alcohol exposure during pregnancy. It's harmful to the neonate. Premature birth weight is a complication, low birth weight, impaired neurological functioning, and high risk of abuse and neglect. Neonates whose mothers have abused drugs can also go through withdrawals as well. Neonate specimens, we could use urine, neonatal hair, meconium, which is the first bowel movement. Mother specimen could be blood, amniotic fluid, placental, cord, blood, or oral fluid. Toxicology is the study of poisons, including drugs, detection, action in the human body, and treatment of their effects. There's also forensic specimens, substances involved in civil or criminal legal cases, and then there's forensic toxicology, testing specimens for poisons or drugs of abuse in legal cases. So these are some of the, when we're looking at forensic toxicology specimens, there's anorectal swabs, arterial or venous blood, bone, cheek swab or buccal swab, capillary blood, clothing and fabric, dried blood stains, and hair. There can also be nail scrapings of clippings, saliva, gastric fluid, bile, skin, sweat, sperm, semen residue, teeth, oral or buccal swabs, urine, and vaginal swabs. I'm kind of going through this fairly quickly because unless you specialize in forensic toxicology specimens or handle those in lab, the phlebotomist, we don't have a lot of exposure to this. They're different than other lab analysis. Specimens are diverse. Specimens may be decomposing or exposed to the elements rain, mud, mixed with other human specimens, trace evidence, single hair, blood stain, often from autopsy for postmortem testing to determine cause of death. There's also DNA testing helpful due to accuracy of identification. It's the same in all cells of the body except the egg and sperm cells that contain 1/2 of the DNA. It stays the same throughout life. It's present in most cells, and it differs from one person to another except in case of identical twins where the DNA would be identical in nature. There is paternity testing to determine a father's identity or maternity testing to determine a mother's identity, dependent upon the DNA analysis. It's used in many legal issues beyond criminal investigation. Paternity testing to determine biological relationship to a child for legal and social benefits, medical history for a child, or evidence for child support. Immigration issues may require DNA testing, and adoption issues to find, identify, or confirm identity of a birth parents. Tribal enrollment in American Indian tribes or confirmation one's heritage. Estate or probate disputes often require proof of kin to determine that they had a relationship with the deceased. Twin confirmation can be determined, twins identical or non-identical fraternal. Chain of custody, this is to maintain control and accountability of specimen from the time it is collected to the time of disposal. Documents identity of each individual who handles the specimen each time a transfer takes place. This is really crucial that this is maintained at all times because, again, this could be used for a legal case. Requires identity verification of the patient, subject, and descendant. Individual who obtained and processed the specimen, date and location, and signature documenting the specimen and container is the one obtained from the patient identified on the sample. It requires tamper evidence seal if the specimen is being transferred or transported. They comply with federal guidelines, so DOT, DOD, NRC, FMCSA, and FRA. This is when it's involved with workplace drug testing. They also comply with FAA, FTA, PHMSA, Coast Guard, and DOE. The Department of Transportation standards for testing of specimens, quality assurance, and quality control, chain of custody form personnel, and reporting of the results. When we're looking at workplace drug testing, it complies with federal regulations. It's comply with customer or contact requirements and insurance carrier and minimize chances of hiring employees who are drug users or abusers. It reinforces a no drug use policy. Identify user, refer them for assistance. It's grounds for disciplinary actions. Establish reasons for disciplinary actions to improve safety and health of the employee and reduce addiction. This is required in an anti-drug program if you were to maintain a job in aviation, highway, road, mass transit, pipeline, hazardous material transport, other safety-sensitive industries. Situations where drug testing is appropriate. Pre-employment testing, again, job offers made only after negative tests. Pre-promotion testing prior to getting a promotion. Annual physical tests identify users and abusers so they can be referred for assistance or disciplinary action. Reasonable suspicion for cause tests, employees who show signs of being impaired or having unsafe work practices. So for example, if you worked in the car industry and you crashed a vehicle, they might have you randomly go take a drug test. Situations where drug testing is appropriate, again, random tests, safety or security sensitive jobs where testing at predictable times. Post-accident to determine if drugs or alcohol were involved in the accident or caused it. Treatment follow-up, clearance to return to work after participating in a rehabilitation program. Investigation of child or elder abuse and operation of company vehicles. When drug or alcohol use is suspected, a lot of times they have you go through a drug test prior to even operating the vehicle. Information for subjects should include where samples will be collected and tested, how results will be reported. Again, a chain of custody is maintained, drugs and cutoff levels for positive and negative, and confirmatory tests used if initial test is positive. Please see Table 17/2 in your textbook. Tampering with specimens, evaluation prior to collection. Secure water sources so they will shut off the water to the toilet and the sink. Water in the toilet and tank are bluing because if the specimen were to be tampered with, they're going to try to dip it into that toilet and it will have a blue effect. No soap, disinfectants, cleaning agents, or other possible alterations are present. Soap can dilute the sample. No unauthorized substance present, and access through a door or window is not possible. They secure areas and items that may conceal contaminants. Recheck above items after each collection to ensure site maintains integrity. The collector may only work with one collection at a time. So when detecting alterations to samples, examination of the urine, they're going to look at color. Is it the normal pale yellow in color? Presence of foreign substances, so they might mix the containers, see if there's anything inside, objects, materials. They're going to look at the order that's maintained, and they check the temperature. Urine temperature is actually checked within 4 minutes. So it should be at body temperature. If it's lower or higher than body temperature, then we know something happened to the sample. Simple tests for detection, so specific gravity, adding bluing to the toilet water, direct observation of devices used to tamper with the sample. So an example of this would be if the patient brought in a urine sample and it was maintained against their body, but the specific gravity would be off and other factors as well. This is exactly why they shut things down, don't let you bring anything in the room. Drug testing in the private sector. Employees may be tested without prior notice, and private employers may request certified laboratory tests for several drugs, or use of different laboratory testing for initial confirmatory tests.